All right, thank you very much, Paul, and greetings, everybody. It's great to meet everybody and to see everybody online participating in this conversation around how we can actually share our lessons that we have learned over the last 2 years. As Paul mentioned, I am sharing on the CVC, PANCAP CVC coin multi-country grant with Caricom as the principal recipient. So we will share our perspective on our experiences over the last 2 years. So let me move to the slides. So the first slide, as you look at the first slide, the grant, the primary objective of our grant was to provide sustainable prevention, treatment, and care services for key populations in the Caribbean region. The grant had 4 central objectives, and these objectives were to increase domestic resources for effective key population programming. Second was to mobilize resources for KP organizations in the region. 3 was to reduce structural barriers to KP services, which include addressing stigma and discrimination and gender-based violence. And the 4th objective was to improve knowledge generation and using strategic information on key populations for decision makers and advocacy by the communities and other stakeholders. Next slide, please. So for the grant, we had 3 sub-recipients or key implementing partners, and we had an additional 5 sub-recipients. And as you can see, PANCAP Coordinating Unit, CVC, which is the Caribbean Vulnerable Communities Coalition, which is a coalition of NGOs in the region, and COIN in the Dominican Republic were the 3 sub-recipients. We also had the Pan American Health Organization, which all of you are familiar with. And then we have the Caribbean Public Health Agency, which is the regional public health laboratory and accreditation framework. We also had a regional NGO lab framework, which is the Caribbean Med Labs Foundation, and the Caribbean Network of People Living with HIV, as well as Senesex in Cuba, which were sub-recipients of this project. The project had, while we are doing public goods that serve the entire region, there were 10 countries that were the focus of this grant. And as you can see, they include Antigua and Barbuda, Barbados, Belize, Cuba, Dominican Republic, Guyana, Haiti, Jamaica, Suriname, and Trinidad and Tobago. So those were the 10 countries in which key activities under the grant were implemented. The project had a conceptual framework which had a collaborative approach, what we call the top-down, bottom-up approach, with PANCAP using their strategic placement as an intergovernmental agency, providing high-level regional advocacy and convening actions from the top, and COIN and CVC as civil society organizations with access to and links into the key populations, providing the bottom-up approach to strengthen and build capacity among the key population and to engage with regional leaders and to effectively integrate the work within the key population communities that we're working with. The grant had a logic model which had a number of outcomes. So the first outcome, which is the ultimate one, was around reducing HIV incidence and mortality. among KPs. We had 2 intermediate outcomes, which were largely around building the capacity of the civil society organization and national AIDS programs to undertake and implement key population programs, as well as the second being to increase access of the KPs to quality care and treatment. The grant had a number of immediate outcomes, and I indicated some of those already in the objectives. They were around domestic resources, they were around reducing stigma and discrimination and gender-based violence, increasing knowledge around HIV and STI services, as well as using strategic information for decision making and to use them to inform the key population actions. So what we expected to come out of this project were some critical outputs. So we are aiming to have social contracts between CSOs and government. We expect that at the end of this grant, we would see increased government commitment to increasing domestic resources. We would see some movement towards reforming laws that can support the reduction in stigma and discrimination and gender-based violence. And we would see some updated, integrated guidelines for HIV programming. And I think ultimately what we look for is improved quality of services and data that support key population programming. So I want now to move to the next slide, which really speaks to some of the strengths that this project had. The project had a number of what we consider to be key strengths because of the top-down, bottom-up approach and the links to both the community as well as the intergovernmental framework, which is PANCAP. So the first one is that the project has the endorsement of Caricom through the Council on Human and Social Development, and therefore what we see is a high level of interest in the activities of this project. The project was around providing regional public goods that can be used across the region, not only in the 10 countries in which we are implementing action. The project, by virtue of its location, had the capacity to engage governments, civil society organizations, and other stakeholders in very strategic ways. We also had the opportunity during this period to engage in virtual operations, which allowed us to reach a wider cross-section of people, including folks who are more rural and for whom engaging with the project was much more cost effective than if we were to travel. What we found is that when we were moving across the countries, it meant that less people could participate because resources were not there to bring as many people in. The virtual modus operandi allowed us to bring more numbers into the conversation. We also, by virtue of the last 2 years, were able to optimize resources by identifying savings quickly and reprogramming some of our budget lines to reflect the changing circumstances. Next slide. We found also that during this particular period, we were able to implement innovative strategies, which has the potential for lasting impact and to enhance the national HIV responses across the region. The approach that we use provided us with connection to multiple institutions in the beneficiary countries through what we found to be a rather dense and solid partner network, which, if we utilize those effectively, can serve us over the long term. The project also benefited from a high level of credibility at both the regional and national level on account of past and present human rights and health-related project experience that both the civil society organizations that were working as well as PANCAP brought to bear on the implementation. And the presence of COIN and CVC on the project and CRN Plus and Seneset provided strong grassroots experience and field communication that allowed us to tackle specific key population needs. Notwithstanding those strengths, though, we identified a number of challenges which I think are not unique to us, but which we want to bring to attention. One is the challenge of coordination and implementation in a virtual environment. We found that operating in a virtual environment had its own challenges and difficulties, which we had to overcome, and we continue to try and overcome. Achievement of country engagement and the slow response time from countries in the period of the pandemic is also a challenge. Most countries are focused on COVID, and the major stakeholders at country level are quite engaged with the COVID response. And so engaging them in a very timely manner is something that continues to prove a challenge for us. And of course, that flows naturally into the next challenge, which is a prioritization of other health issues over HIV at the country level. The implementation of a number of government safety measures and consequent travel restriction affected movement of goods and services, which affected our ability to travel and to do some of the work which originally was planned to be done nationally and internationally. And we also had the challenge where a number of staff involved in implementation were diverted to implement other activities, which led to a consequent shortage of staff for implementation of some of our key project activities. We also had the experience where a number of beneficiaries were quite busy, and not only busy, but also sort of began to be tuned out of the virtual engagements because of the issue of meeting fatigue. And that's something that we have to constantly be looking at ways to incentivize and to ensure that they're constantly engaged. The virtual engagement, notwithstanding its advantages, we also found that a number of countries and communities had challenges with internet penetration. So for example, in Haiti, we had significant challenges and people literally had to pay for internet to stay on the calls. And so there was some personal impact on the beneficiaries in their ability to participate in these online engagements. The other thing that we found was that the challenges of the period also resulted in a number of our participants who would normally engage with our activities having their own individual income circumstances that they had to prioritize, and therefore they had to make choices about what activities they participate in. We also found that a number of our CSOs had to scale back their operations because of limited resources to support them during this particular time as well. And the final slide that I'll go to really speaks to the continuous challenge that quarantine of project staff poses to the project implementation and some of the disruptions of activities that brings with it. We also recognized during this period that there were significant structural and institutional barriers that continue to interfere with the advancement of the project goals. And a number of our beneficiary countries proved to be difficult working in due to some complex political and administrative systems that were at play at country level. We also recognized during this period the real lack of CSO institutional capacity to adequately respond to some of the activities that we were trying to implement. Despite our efforts and our training and provision of technical assistance, there still remain some weak CSO institutional capacities on the ground. And in particular, in one of our countries, which is Haiti, we had major socio-political and economic unrest, which continue to pose some challenge to the implementation of our activity. So in a nutshell, those are some of the strengths of our project and some of the challenges that we face during implementation, notwithstanding that we managed to move ahead with major activities under the project. And we think we continue to make progress, but we still have some of these challenges that we have to respond to as we come towards the closeout of this project in another couple of months. So that is the presentation from the PANCAP CVC Coin Multi-Country Grant, and we can respond to any question or comments that you might have when we go into the Q&A section. Thank you very much.
Good morning, everyone. Buenos días a todos y a todas. Let me first of all thank Paul from the Global Fund for putting this on. I think that this exchange is very important. As Ronald said earlier, although we are divided in terms of language, in the Caribbean we speak English, and in Latin America you speak Spanish. We're still one region, and so we've seen of late there is a movement of people from Latin America in the Caribbean, and even so people from the Caribbean also move to Latin America. At the end of the day, what we're doing is that we're working to make the lives of the people of the region better, people who are impacted and are affected by HIV, TB, and malaria. I think that this exchange is not only for us sharing information, but for us to learn what are the challenges as was laid out in the two previous presentations, and how best we can strategize in overcoming these challenges so that we can deliver on our mandate and we can better serve the people of the region. Ronald also mentioned the issues around inequalities. As you know, the Caribbean and Latin America is a region that is faced with great inequalities, and with the COVID-19 pandemic, the ongoing COVID-19 pandemic, there is the potential and there is the risk that the inequality gaps across the Latin America and the Caribbean will only widen. And with that, it is going to make our work even more challenging as we try to reach people who are affected in the region. So I hope that what we can take away from today's session is that we can work closely together as a region, learning from what has been done in Latin America and in the Caribbean, the best practices, also recognizing the similar challenges, and to be able to strategize around these challenges to be better able to serve the people, but also to use this as a stepping stone or a springboard to further strengthen the collaboration between Latin America and the Caribbean. I think too often we looked at the region as two divided region, sub-region, but I think that despite the differences in terms of language, we are in the same geographic region, and so we need to strengthen and ensure that this collaboration continues and go on, so that we can really get to the sustainable development agenda and ending AIDS and other communicable diseases in the region by 2030. So thank you very much for putting on this session.